So I think that it would be beneficial if from the beginning, it's just part of the conversation about taking care of your newborn. You're given so many pamphlets and handouts and papers when you're just recovering from childbirth or just, having this new person come into your family without any explanation. You don't know the baby's gotten a heel stick. You don't know that it was for jaundice. I mean, when I had my son, I knew what was going on because I had done pediatrics. But even still, people couldn't necessarily answer my questions. So I think having it be more of a conversation where it's more part of your discussion with your pediatrician that this happened to your newborn at the weight checks, that there is a team of people that is keeping an eye on this, that it's just part of having a normal newborn would be useful, on top of more education for providers. The newborn screen is rapidly expanding, and it's a great tool, but it's just that, it's a tool. So if you don't know that there are ways to use it, it can be wielded poorly and have outcomes that people aren't expecting, using the term, your child has been diagnosed with this disease, so you have to see the genetics doctor. Your baby is abnormal, so you have to get this test. Like there are ways of phrasing these results that can be really damaging to families, and increase the fear and the uncertainty. When we talk to them that this is a screen, this isn't black or white yet, and though that can increase stress, it also provides an avenue for hope. Like this could be a false positive, and hopefully the stress will be behind us in the future. And if you don't ever have to see us again in genetics, we understand the joy that comes with that and the relief. But if you do, we're walking this path with you. We have tried to do lectures to talk to pediatricians and the pediatric residents who are in training about how the newborn screen is expanding, what these results may or may not mean, how to broach this kind of discussion with families, because you're, again, taking them from a well, healthy child to a potentially sick child. And that is a very fragile discussion that has a lot of ways in which it can be inadvertently damaging. And you don't want to destroy a family's relationship with the medical field when they may need it in the future, because all of us eventually get sick. But if they end up having a genetic condition, you really want to be careful about how you phrase these things.